I think we've gotten a lot of information about what causes lupus over the past several decades, but ultimately we don't fully understand what we call the pathogenesis. What is the mechanism of that causes the disease? So hopefully my research will help us better understand what is the underlying cause. So lupus is a chronic autoimmune condition that leads to widespread inflammation in the body that can cause organ failure or organ dysfunction. So we know that there's more to it than just genes. So some of the things that we think are important in triggering the immune system to behave this way would be things that are out there in the environment. So that would be exposure to UV rays, certain chemicals or air pollutants. Smoking has been associated with increased risk of developing lupus, obesity, as well as sleep deprivation.
My name is Philippa Mennel, and I have lupus. And I was diagnosed when I was 21, and I've had it for 23 years. I was in my third year at university. I started to develop some muscle pain, joint pain, and when I went to get treatment for it, it was thought to be just stiffness associated with being tired and studying for exams and things like that. But it kept progressing, it kept getting worse. Eventually, I had very swollen joints and couldn't move. Fortunately, I had a GP who had recently seen a lupus case, and he was very alert to it and ran all the tests, and yeah, it came back as lupus.
So one of the research passion of mine is looking for biomarkers that can help us with an earlier diagnosis of disease. Biomarkers in a general term means basically any fluid or tissue in the body, you can find molecules that we are looking at whether or not they're helpful in helping us make diagnosis. So what I mean by that is that there's been research to show that even before patients get diagnosed with lupus, you can find these molecules in the blood even a decade before. And so if we can find these biomarkers in the patients and counsel the patients about things that they can do to prevent disease, or give them some ideas to what is their risk of developing a disease like lupus, I think that would be really informative for the patient. Making an early diagnosis is also important because then we can initiate treatment that would then prevent them from developing damage to their organs that in many, many cases is irreversible.
Initially, when I first received the diagnosis, I was really scared. The only other sort of instances of lupus that I'd ever heard of were really remote cases for me. I didn't know anyone in my immediate world who had it. I think it was hard for me at that stage because I was almost finished university, and there was some question as to whether I could go back. There was some question as to whether I could finish. All my plans kind of changed based on what I had intended versus what I might now be capable of doing and how my life had to change.
My lab is a special lab that is able to discover new biomarkers, and we're able to develop tests for that. We also have a dry lab where we're then able to take those biomarkers and use machine learning to try to understand what are the roles of these biomarkers. So one of the things that we did recently is that we did some biomarker tests, a very comprehensive list of proteins. Some of them are novel, have never been looked at in lupus, and some of them more established, so things that your doctor would order if you have a diagnosis. And we tested it on over 800 patients with lupus, and these patients had blood taken at diagnosis a few years later and then 5 years later after they were diagnosed, so repeated tests. based on just the blood test alone, we were able to identify 4 different types of lupus patients. And it was very interesting to see that these patients not only looked different, but their prognosis was different.
I think this research is really exciting. I think the idea that you could have a bit more of a focused understanding of how lupus might be working in the body, what the mechanisms are that are actually, ultimately causing the disease or even triggering disease flares or particular kinds of symptoms is really exciting. More practically, maybe my hope is that we find therapies and practices and methods that improve the quality of life of people with lupus and arthritis in general.